Hi, I'm Sarah Blair, dentist and co-founder of Indie Practices. At Indie Practices, we are leadership coaches and we focus on dental practice success. In my own practice, one of the biggest keys to success was great communication, and handoffs, sometimes known as transfers, are essential to that communication. In the notes below, you'll see a link to a document that accompanies this video. I highly recommend that you download it and share it with your team, and then watch this video together in a team meeting using the document to guide you. So first, what is a handoff? So a handoff is a transfer of information and responsibility for the patient from one team member to the other. And it can sometimes be just verbal information, but most often it's a combination of written and verbal information.
Handoffs take place at several different points throughout a new patient and returning patient visit. The document focuses on a new patient visit, but most of these elements apply to every appointment type. This page from the handout summarizes those 4 key moments.
The first handoff is really easy to overlook, but it's essential to creating a good first impression with the patient. The patient must feel known and welcomed from the moment they arrive. We don't want to make them repeat anything that they already shared on the phone. This can be really hard at a busy front desk, so this is one where it's best to share the information in writing. Every practice is different, so you'll have to figure out what works for your team, your software, and your situation. So the handoff will simply be something like this. Hey Jen, this is Mandy. Mandy, this is Jen. Jen will be taking care of you today. And then Jen says, hey Mandy, so great to meet you. Welcome to our practice. Let's head this way. And Jen will have already read the information that the patient had shared on the phone, so she doesn't have to ask any questions at this point. The second handoff is maybe the most important. The hygienist or dental assistant must prepare the patient before the dentist enters the room and then hand off the information to the dentist in front of the patient. So it could look something like this. Hey doctor, this is Jenny. She lives right down the road with her husband and they heard about us from their neighbor. Jenny noticed this really sharp edge on the lower left molar and it's been really bothering her. So I took this photo and we looked at it together. You can see that there's this really big old filling and it kind of looks like there's some decay around it, and it just looks like it's not in great shape. So she's a little concerned about it. Luckily, she's not having any pain yet, and she really does want to save this tooth because she wants to be able to eat her favorite foods. So I told her that often in this situation you'd recommend a crown, but that you'd take a look as soon as you got in. So Jenny, was there anything else that you wanted to add for doctor? The next handoff is from the dentist back to the clinical team. And the most important thing here is making sure that everyone is on the same page moving forward about next steps, the dentist, the team, and especially the patient. So we want to say back again what's going to happen next out loud. It could sound something like this. Okay, Amy, Victoria wants to focus on the most concerning and urgent things first. So we're going to make a plan with 2 steps. First, she'll see me for an appointment as soon as possible for 2 hours. That'll be to rebuild the broken tooth and to stabilize it long-term with a same-day crown. The next phase will be with Janelle, our awesome hygienist, to start treating the gum infection that we talked about. We'll need 60 minutes for that appointment, and that'll be phase 2. The final handoff is from the clinical team back to the front office team. Most important here is to give the front office team enough time and information to prepare for this conversation. So make sure they have a heads up in advance. It could sound a little bit something like this. Hey Daria, this is Mr. Ellis who just saw Dr. Tim for a full exam, a set of x-rays, a preventive cleaning, and we also applied some fluoride varnish to prevent future decay. The next visit will be for 60 minutes with Dr. Tim to take care of those 2 areas of decay down on the lower left. All right, see you next time, Mr. Ellis. So that conversation is really for the benefit of both Daria and Mr. Ellis because it helps for Daria to confirm what was done today and what's coming next to make sure there are no errors. But it's also really great for the patient to hear this information again. Again, clarity is key. Having patients hear the information at least 3 times is super important. It's one thing to learn about handoffs, but it is much trickier to implement it in real life and to make the language flow smoothly. So I really recommend that after you've watched this video and used the handout, that you practice practice this as a team. So pair up and use the language together until it sounds natural and you can do it in the operatory with patients. Thank you so much for letting Indie Practices be a part of your team meeting. Have a great day.